Thank you so much for joining another one of our Sarcoidosis UK videos this afternoon. It's great to have you all join us. As many of you know, today we'll be discussing the restrictions that have been lifted. We'll be joined by a few guest speakers who I'll be introducing shortly, and they're going to be giving their viewpoints on why it's still important to be protecting others, wearing masks in certain places, and we'll be discussing, as I said, all the restrictions and the new kind of the lack of rules that have come into place today, and all the changes and their consequences. Before we get into the video, I'd just like to thank everyone who is continuing to support the charity. It means so much to us, and it's vital that we are able to continue this momentum of support to be able to continue to support those who have sarcoidosis and are affected by it each and every day. If you would like to make a donation, we'd be extremely grateful, and you can do so over on our website. We'd also love to have some more fundraisers join our team. We've had some incredible successes recently with people who have done some amazing fundraising work. So if you'd like to look at the events that we've got going on, you can head over to our website on the fundraise and events section. And if you'd like to do your own fundraising event, then you can contact me at charlene@sarcoidosisuk.org, and I'd be more than happy to discuss different fundraising ideas with you. And as I said, we'd be extremely grateful for any support that we can get from that way. So to get into the video, as I said, we're joined by a few guest speakers, so I'm delighted to introduce them. First off, many of you will recognise Jackie Newton. She is a patient ambassador for Sarcoidosis UK and has also done moderation work for the Facebook Sarcoidosis group. She was recently involved in our Neurosarcoidosis Patient Day as well, and is loved by a lot of the Sarcoidosis UK community. So we're delighted to have her join us today to join in our discussion. Secondly, we have Alice Pearce. Many of you may recognise her as well from the Facebook Sarcoidosis UK group as a moderator. She is also the chair of the Sarcoidosis UK Bristol support group. So thank you so much, Alice, for being here today. It's great to have you join us. Lastly, we have Juliet Coffer, who many of you might have seen on our social media. She is an incredible fundraiser and sarcoidosis patient. She did an amazing job of, so far she's raised £17,000 for the charity from her walk that she did, and if you haven't already had a chance to look at her page and what she's been up to, the links to that are in our social media, so go ahead. I thoroughly recommend checking that out because she's got an amazing story, and we're delighted to have her join us today because I think each of you will really bring a great contribution to this discussion. So thank you so much all for being here. It's great to have you.
Hi all, thanks.
Great. So, as I said, the topic for today's video, we thought it would be really kind of helpful and beneficial to those people who are affected by sarcoidosis, just to have a discussion about the restrictions that have now ended in England. So, as you know, you'll all have been following the news that from today, Boris Johnson has kind of ceased the rules around restrictions. It's now a personal choice whether people want to wear a mask in public places, and people can meet outside freely. There's no kind of rules in hospitality, restaurants, things like that. So with that bearing in mind, we know it's been a long time coming for many people. It's been a very turbulent year, and we do recognise the need for a return back to some sense of normality. However, this does kind of bring about questions about how people who have been really badly affected up till now are going to progress forward. So as I said, that's the discussion point for our video today. So there have been some kind of indications that these rules might shift. Sadiq Khan has already said that in London on all transport, masks will continue to be compulsory, and it's hoped that other cities may follow suit as well. So definitely be interesting to see in the news over the next coming weeks if that manages to gain some momentum. The NHS kind of federation have also released a new campaign that is called Not Too Much to Mask, really highlighting the need of why we still need this level of protection amongst us, even though things have kind of taken the turn that they have today. So if I just open the first kind of question up for discussion for the group, it's what is your position on masks and why? Maybe Jackie, would you like to take it off first?
Hi, thanks very much, Charlene. So my position on masks is that if it's possible to wear a mask, it's very little to ask. So if you can do, please do. And if you can't, then at least keep your distance.
Yeah, for sure. Alice, Juliet, I'm guessing you're both in that same boat. Both second that.
Absolutely. Put it very succinctly there, Jackie.
Yeah, I thoroughly agree. For me, I never, as well, Jackie says, if you can wear a mask, you should. Or if you can, you could. I've always wondered why, like, a piece of material should create such a discussion point when it's something that's so important for public health. It's become such a symbol in our lives of freedom, that so much is attached to it. And it's just a piece of material to protect us. I wear mine to protect you, and then you can wear yours to protect me. And I think, you know, we're told to have personal responsibility, but it should be a community responsibility. We should all be responsible for each other. There are those of us who are vulnerable, and we can protect ourselves to a degree, but we need your help too in this instance with this disease. So that's kind of where I sit. I want masks to come away from the political arena and become a health issue, not a political tool.
Yeah, I think that's a really good point and a very interesting distinction to make. I do definitely agree with you there. It has kind of taken the transition away from health, and it has just been seen as this political stance, and people who don't agree with masks or are happy to kind of see them go from this end are kind of often linking it far more political than health-wise. So I think that's a very good distinction to make, and we'd encourage people to, you know, consider just from a purely health point of view how just wearing a simple mask, it's not very much to ask, can actually really help protect both yourself and others around you. So yeah, really good point with that. How do each of you think that the lifting of restrictions are going to affect you? And I know this could be a bit of a double-ended answer because there are both positives and negatives to it. So it would be interesting to know, yeah, how each of you think it's going to affect your lives from now on.
Shall I start?
Go for it. Yeah, sure, Alice.
I think it's making me much more anxious, and it's going to reduce the things that I can do.
Yeah.
So while people were social distancing and wearing masks, and there were rules for restaurants and shops and things, I started to feel after my vaccinations that I could go out and do things. Mm-hmm. And my children are in primary school, so them going to school again was quite an anxious thing. But it was okay for a while, but now it's starting to feel like actually it's quite dangerous again. So I'll be doing much less in the next few months. Who knows beyond that? I won't be going out to restaurants and things unless I can find somewhere quiet outside to sit. The school holidays, whereas normally I try to find lots of things for my kids to do, we're going to go to my parents because I know they're going to be doing the same things as us and looking after themselves. So that's it. That's where we're going. There won't be outings and trips, and you know, there might be one or two friends of the children that we can visit because I know that they're taking things seriously, but otherwise there won't be meeting in the park with half a dozen of their friends and things. So it's really going to restrict my life, but my children's too.
Yeah, it's a huge impact, and I'm sure a lot of people are going to be in the same boat as yourself, with people with young children that you know, it doesn't just affect your life, it's the whole family's life. So it really is a lot to consider. Juliet, how about you?
I'm in some ways in a fortunate position because I'm still shielding. We haven't stopped shielding here. So lifting of the restrictions, unless we have to go out. My husband's lucky enough to be able to work here, and so we stay here. But there are other things that will affect us. I've seen my parents once in 21 months. Just after we got jabbed, I finally got brave enough to leave the house. We stood in their garden about 10 meters away, everybody masked up. I almost I think my dad's probably watching. I almost made him drink his soup with the mask on. I was so scared. So it was, I know. And but even then, at that point, there were people in the gardens around, and apparently I was jumping every time I heard somebody cough or talk, and you know, and that was being double jabbed before the numbers went up. But I think the real big thing for people will be anxiety.
Yeah.
You know, you can make decisions and take risks, but it's the anxiety, I think, that's the hardest bit. When they first announced the lifting of restrictions, I went through a whole series of very big panic attacks, to the point where I couldn't watch the football for the European Cup because I couldn't face seeing crowds of people together without masks. And I literally had to come away from watching one of the England games because I had a panic attack seeing all those people. And I think, you know, there's a lot of people out there who are shielding or who are in a position where, you know, they do have to go out. And I think that the anxiety and the mental health side of things is going to be the biggest issue. And there's people that don't have a choice. There's people who work, have to go on buses, have to go for treatment to hospitals, you know, and they don't have a choice with these restrictions lifting. And it must be really difficult for people. As I say, I'm fortunate I don't have to go out. I couldn't imagine how I would be if I had to get on a bus or a train every day, or if I had to work in a public facing job or even in an office. So I really feel for people that have to make those choices and decisions. Very difficult.
Yeah, definitely. I think, again, you've drawn on a really good point there about the mental health side of things. I think for so many people, it was very common knowledge that a lot of people really, their mental health really deteriorated throughout this past year and a half. There's been so many, you know, change in rules in and out of lockdown, and you know, that does have a real effect on people's mental well-being. And I think now that, you know, suddenly it's kind of gone from one extreme to the other, where people are suddenly allowed to go out and it's, you know, a personal choice, etc., that people might feel a bit overwhelmed as well. So that feeling of being overwhelmed in large crowds when, or if you are going into a supermarket and majority of people don't have masks, or if you're on like public transport, the train, and there's a lot of crowds around you and people, you know, aren't there's no social distancing, there's nothing like that in place, can also just be that feeling of being incredibly overwhelmed, and that paired with anxiety, etc., and stress can be very harmful for some people. So it's important to consider how others will be feeling in this situation, apart from yourself, even if you aren't affected. Jackie, would you say that you kind of you think it's going to affect you in a similar way to Juliet and Alice in terms of the restrictions lifting?
Absolutely. For me, hearing Boris Johnson say that it's down to the clinically vulnerable people to decide on their own risk is a total misnomer. There's no way one person can tell what risk they're under when it's other people's decision whether to protect us or not. So that is just it's just a contradiction in terms. Going forward, yes, society does have to open up. So we have to be responsible for our own health. But if it comes down to employers just requesting people to distance and wear masks, then there's nothing to give us any backup if we find ourselves in a situation where we couldn't avoid, like being on public transport or going into hospital or surgery, if it's a decision by the individual whether they're going to wear these masks or keep their distance. And so I think we've seen that although most of the public are very considerate, there are people who aren't considerate and who are fed up of the whole thing because they've maybe not lost anyone to the virus. They maybe don't appreciate that we could actually be at high risk of either long COVID or triggering an immune system condition. It doesn't necessarily have to be sarcoid, but other immune systems, immune diseases can be triggered by infection. So there's all these things to consider that an unmasked person could cause someone else to have. And so in lifting all restrictions and mitigations at the same time, people like us who have to consider whether even the vaccine worked will be feeling very like they're back in, it's worse than shielding, because at least we had the legal implications before that could back us up. But humanity has to survive on compassion and consideration for others. And this video will be going out to people who are these people that have compassion and care for others, but it's the people who don't understand that really need to see it.
Yeah, I completely agree, and I think what you said there about the onus is being currently put on people who are vulnerable, when really the onus and responsibility should be put on everyone, and that's drawing into what Juliet said, that kind of approach. It shouldn't be a personal choice, it should be more of a community approach, and more of a togetherness in this. And obviously people have had their own difficult experiences over the past year and a half, and there have been examples of people showing incredible kindness to others and generosity, and I remember at the start of lockdown it very much felt like that community feel, we're all in this together. But I think as time has gone on, and especially now with restrictions ending, that attitude has kind of been lost a bit, and people have now just got that mentality of thinking about themselves, and not considering how it might affect others. And I think another point that you made there, Jackie, is really important to note as well about vaccine efficiency. So a lot of people in the UK, adults, would have received both of their jabs, but it's important to consider that people who are immunosuppressed, or people who have conditions that make them clinically extremely vulnerable, might not have the same level of protection as other people do. So vaccine efficiency, it varies based on people's illnesses and conditions that they do have. So while someone might have received the vaccine, they might have a much lower level of protection than someone who doesn't have a condition. So it's important as well to consider that, and not just disregard people because they've had the vaccine. It doesn't necessarily mean that they've got that really high level of protection, which I think is very important as well.
If we're trying to make our own risk assessment on what we should and shouldn't do, there's too many unknowns there.
Yeah.
We don't know what other people are doing. We
Yeah.
don't know if our vaccinations have worked properly, or if they're much lower than other people. There's too many unknowns to do any kind of risk assessment for ourselves. So
Definitely.
we need other people to just do these small things to make a difference.
But the other side of that is as well, we can't see who's been vaccinated. Are we all supposed to walk around with stickers on, or how do you know who people are? But I think like a whole an important part of all of this is education. And I think that where the government are missing a trick is educating. Whilst they may not want to assist the clinically vulnerable, and they want us to become part of the same stream as everybody else coming out of the restrictions, I think if they could educate people as to why they need to wear a mask, why they need to distance from people, because people like us exist in society. I think if you educate people and people understand, then they have an ability to make a choice based on information, as opposed to just assuming, and I go back, it's just a piece of material. I watched a very interesting video on Twitter today from another organisation, where they explained why why it was important for masks to be worn, and how teachers, doctors, nurses could all be vulnerable. You wouldn't be able to see it. No stickers, nobody knows. But if you educate people and tell them why you have to be careful, I think that could help, and that could help with the lifting of restrictions.
Yeah, I think I definitely agree with you there, Julia. I think it's a very important part of this is education, which does kind of lead on to the next point that we were going to discuss. We have kind of touched on it already, but it's really outlining why should those who are not clinically extremely vulnerable or immunosuppressed continue to be cautious. So some of the key points we've raised already is that, just because they might not be affected, it doesn't mean that they could, you know, not pass it on to someone else. Those who are affected, either immunosuppressed or clinically extremely vulnerable, cannot tell who has been vaccinated, who's not, and that then obviously impacts them on their decisions of where they can go. Is there anything anyone would like to add to that point, to just emphasise to people who may be watching who still don't quite understand why those who, you know, aren't immunosuppressed or clinically extremely vulnerable should wear their mask?
Well, let's go for the person who feels invincible. That person probably hasn't got experience of people being disabled or needing attention. And if that's the case, will they actually listen to educational movies or whatever? I think the best way to put this forward to people in that position is to show how people of their age, of their situation, suffer from COVID. Because we're hearing more and more now that even mild symptoms of COVID can cause long COVID. And so someone may have had COVID, develop symptoms in the future or now, and won't know what caused it. So they'll be left in a very similar position as to people with sarcoid in the beginning, because there isn't a blood test that will say what's causing the symptoms. They may well find they've got antibodies to it, but they won't know that that was the cause unless they had severe symptoms and had already been designated as someone with severe COVID. So I think if they could understand that in actual fact, this virus will mutate, and the more it's spread, the more chance there is that it'll mutate. It could mutate into a disease that kills children. We don't know, we just don't know what the virus will do. If that's the case, they need to, that could be the case, so they need to think of what would be the worst case scenario. Would you pass this on to your parents? Would you like to be responsible for developing a new variant that could be worse than the one that we're dealing with at the moment? And of course, this one is the Delta variant is so contagious that more and more people will get it. And then the more people that get it, the more chance there is that a new variant will come out of it. And we just don't know what that will be. So in terms of targeting people, I think probably it's maybe that age group that haven't yet been vaccinated and need encouraged to be vaccinated, even though with a vaccine you could still catch COVID, it still lowers the death rate and the serious illness. So possibly that's the kind of message they need to get.
Yeah, no, definitely. And if anyone has not able to have their vaccine yet, or they, you know, if there are still people out there that have their concerns about it, we have done a lot of Q&As in the past with regards to vaccines, and they're still up on our website. You can go have a look at them, or on our YouTube and Facebook pages as well. So please do go watch those if you still have any kind of questions around vaccines. In terms then of what you will each be doing individually to protect yourselves going forward, I know, Juliet, you've kind of answered this already. You've said that for you, you're still going to be shielding, and Alice, you've kind of said that it's going to be having an impact on especially school holidays. It's a long time, isn't it, to have the kids at home, and you're not going to be able to do all the activities that you were going to do before. Does anyone else, you know, is there anything else that people can be doing who are in a similar position to yourselves that they could do to protect themselves?
Well, I think anybody in our position may well only do what's necessary. It's not a case of we have freedom now to do whatever we want. We have less freedom now. And what we will do is we will be responsible for ourselves, and we will only do what will keep us as safe as possible. But there are times where we can't do that. We have to attend our hospital appointments. For instance, I'll be travelling down to London for 2 different hospital appointments in 2 different hospitals. And so if I was travelling by train, I'd feel safe in a carriage because it's legally advised that you need to wear masks. But once we cross the border, people could take their masks off, and we can't predict who that would be. We'll still be separated at decent intervals in a carriage, I would imagine. But because of that, now I feel I've got to get my husband to drive us down so that we're not interacting with anyone and we're in our own car, so we're as safe as possible. But then I have to consider what will happen at the hospital. I don't know whether people will be wearing masks at the hospital. And so for us, we need to just keep the recommended mitigations in place as far as we're concerned, and continue to only maybe do things where we know it's less likely we would be at risk.
Yeah, no, completely.
Yeah.
And as many of you will have already seen, Sarcoidosis UK has put out an official charity position on this. If you haven't been able to read the statement, then it is still available on all of our social media channels. But kind of just to highlight what we've all been saying in this video, this is all reflected in the official charity statement. So we are very much encouraging everyone to continue to wear their masks in places such as hospitals, GP surgeries, chemists, supermarkets and transport, so that people who are clinically extremely vulnerable or immunosuppressed or at risk in any way are able to still get to their appointments safely, to get to their hospitals and GPs if they need to access their medications, and to be able to go to the supermarket. It's really simple stuff that, you know, it doesn't take a lot from people to still be wearing masks in these spaces and just have that level of protection and consciousness for other people. As we said, not everyone has the same level of protection from the vaccine. Some people are also not able to get the vaccine because of their medical history or some other factor that could influence it. So that's important to bear in mind. The charity encourages everyone to be cautious and to still act with empathy towards others. You know, COVID hasn't suddenly gone just because today has been marked as Freedom Day and the government have chosen to end all restrictions. It doesn't mean that COVID is not around. If anything, we've all seen the rise in cases over the last few weeks. So it's really important that everyone does still, you know, consider these aspects, and we would strongly urge everyone to continue to wear their masks in these places, as we all will be, as we've discussed today. So I think it's really important, as I said, that we've had this discussion. I know that a lot of people watching will really empathise with some of the points that have been said, and that, you know, there are people out there who, you know, are really going to still follow these rules and things. So to that, that's obviously really great, and that's what we'd encourage. For those people who, you know, might not have realised up until now the significance of wearing a mask, I hope the video has really given you a bit of information and guidance as to why this is still important. And thank you everyone for kind of joining this video, and, you know, to Juliet, Jackie and Alice, it's been great to have you join. Does anyone have any last comments that they'd like to share just before we finish?
I'd just like to say that I think the work that you're doing with this is fantastic, sharing this information and talking to people about it, but I think we can all do our bit as well. I've always been a bit reticent about putting anything important on social media. I just don't want to get into a fight, but actually this is really important. So I have been promoting what I feel about this. I've been saying to friends and family and, you know, all those dozens of acquaintances that you don't really know that well on Facebook, actually this is important and this is why. And if that results in a discussion online, well then that needs to happen. So we can all do our bit there, I think.
Definitely. Well, thank you everyone for joining the video today. Thank you for watching. And as I said, we do really appreciate any donations that are able to be made. So if you would like to make a donation, you can head over to the Sarcoidosis website and do so there. And as I said, if you are interested in fundraising for the charity as well, do get in touch and we'd be happy to help you with your fundraising journey. But for now, as I said, I encourage everyone to go read the charity's position on masks and restrictions wearing, and thank you once again to the speakers for another great video. We do have another video coming up in August, so be sure to keep an eye on our social media pages for more information following soon. Thanks everyone, bye.
Thanks, bye.
Bye.
Bye.